Hi guys, video is for those patients who have disc herniations. So what we're going to talk about are the low back extension or Mackenzie exercises. There's 3 different positions that we're going to go through. Each position you're going to be holding for about 30 seconds and you're going to progress as you go. Of course, with any exercise that we talk about, if it's too much, too painful, don't do it, okay? So the first step is we're going to lie on the table and you're going to make sure what we call the prone position. So you're just going to have your head straight down here and your hands to the side. And the area that we're focusing on is this right here, this low back area, because this is where the disc, when you have a disc herniation that's posterior, meaning that it's shifting out to the back, this exercise is to try to help that disc to shift back forward or anterior. So this is your starting position. You'd hold this for about 30 seconds. I suggest trying to keep your head straight just because it takes less pressure off your neck. The next step, you're going to kind of take your hands underneath here, underneath your chest, and just curl up into this position. So what you're doing with this, you're kind of resting on your forearms here, and the area is right here. This is the area that's your fulcrum. This is the area that you're trying to move through. So then you're in this position, you hold this for 30 seconds. And if this position is fine for you, you're not having any major issues or restriction issues, then you can go to the next, which is where you're going to do a little push up. So you're going to take your hands here and you're going to push up. Now, the thing to remember is that you don't want to be lifting yourself up like that. That's not what we want to do. You want to make sure you're using your arms to push up. And again, your fulcrum's right there, making sure that that's the area that your back is moving, okay? So you get into that position wherever's comfortable. You might go higher or lower, it depends on your injury and where you're at, and you hold that position for another 30 to 60 seconds, again, depending on how you feel. Once you've done that 30 seconds, take a rest, take a break for about 30 seconds, and then do that one again, depending on if you're just on the resting position or if you're in the push-up position, depending on where you're at in your healing. So I hope that helps, guys. If you have any questions, of course, message me, and we'll talk soon.